Hi, I'm ImHollyElizabeth. Welcome back to my channel, and today we're going to be debunking some healthcare myths versus reality. From staffing and funding to what nurses actually do on a shift. So sit back, relax, grab a cup of tea, and let's get into it. Healthcare is full of strong opinions from patients, politicians, the media, and even from us. But some of the most common beliefs, especially surrounding the NHS, just aren't true. This one's especially for NHS nurses, AHPs, junior doctors, and UK health practitioners, because if you've ever sat there and thought, if only they knew, then this video is for you. Let's get started. Myth number one is the NHS is free. And this is probably the most famous one. The NHS is often described as free healthcare, but that is not quite accurate. The NHS is free at point of use, but not free overall. It's funded primarily through general taxation and national insurance. So it means everyone does pay in, but not just at the bedside though. And many services aren't free, such as prescription charges in the UK, dental care, optician services, and some community and social care support isn't free. Myth number two is that nurses just follow doctors' orders, and this one refuses to die. Nursing in the UK is a regulated autonomous profession with its own scope of practice, accountability, and clinical judgment. NHS nurses perform independent assessments, escalate and de-escalate care, make safeguarding decisions, administer and withhold medications based on clinical status of the patient. They lead end-of-life care, wound care, continence care, and long-term condition care. Under the NMC code, nurses are personally accountable for their actions. You know, the term "I was told to do so" is not a defense statement for nurses, unfortunately. Nurses don't just assist in care, they deliver and they coordinate care. So it's all part of the MDT team. They all work together, you know? It's not just the doctor's orders. Myth number three, and I've covered this topic previously, is that staff are burnt out because they can't cope. And this myth is not just wrong, but it's harmful. The reality is that burnout in healthcare is a systemic issue and not a personal failure. NHS staff face chronic understaffing, high patient acuity, moral injuries, so knowing the right care to give, but due to pressures and time limits, just being unable to fully give it, you know? And emotional labour, trauma exposure, and compassion fatigue. Research consistently shows that burnout is linked to workload, staffing issues, leadership, and organisational culture, not resilience or personality. You don't fix burnout with yoga, okay? You fix burnout with safe staffing and realistic expectations and support. So, yeah. Myth number five is short staffing is just part of the job. This one is deeply normalised in UK healthcare, specifically in the NHS. The reality is that short staffing is not normal, it's not safe, and it's not inevitable. Evidence shows that unsafe staffing levels lead to increased mortality, increased medication errors, missed care, and higher staff sickness and turnover. The fact that nurses just make it work doesn't mean it's acceptable. It often means that staff are absorbing risk on behalf of the system. Being professional does not mean tolerating unsafe conditions, so. Myth number six is that the NHS would cope just fine if people just stopped misusing it. And this one usually targets A&E attendances. The reality is that whilst inappropriate NHS use exists, it's not primarily the cause of NHS pressure. Most pressures come from bed shortages, delays in discharges, lack of community and social care, and workforce gaps. And many patients attend the A&E because they can't get a GP appointment, community services are overstretched, or they just don't know where else to go. Blaming patients distracts from structural issues. So, yeah. Myth number 7 is that nurses leave because of their pay. And while pay matters, it's not the whole story. The reality is that NHS nurses leave the profession due to things such as unsafe staffing, lack of autonomy, poor leadership and culture, moral distress, and burnout and work-life imbalance. Competitive pay does help retention, but respect, safety, and sustainability matters just as much, maybe even more than that, you know? The NHS doesn't survive because it's simple. It survives because staff constantly compensate for complexity. Challenging myths isn't about negativity, it's about honesty, because real solutions start with real understanding. If you're an NHS nurse or a healthcare worker watching this, your feelings and your experience is valid and you're not imagining the pressures. If this video resonated with you, share it, talk about it, and keep questioning the myths because the reality matters. Thank you so much for watching. Don't forget to like the video, comment, share, subscribe to the channel, and I'll see you next time. Bye.